All right, can everybody hear me? We're all
Yeah.
on. All right, so we're actually now officially on our live stream. This is the city's first Google Hangout. It's being hosted by the Chicago Department of Public Health. For those of you that are watching on live stream, I'm Jose Munoz. I'm the deputy here at the Chicago Department of Public Health. Hanging out with us today, we have Chicago's Public Health Commissioner, Dr. Bashara Shakir.
Hi guys.
We have blogger and an HIV activist, Ray Lewis Thornton.
Hello.
We have Tracy Bain, editor and co-founder of Chicago's Windy City Times.
Hello.
And we also have Keith Green, Federal Affairs Director at AIDS Foundation of Chicago.
Hey there.
Great. So for those of you that are joining us on live stream, remember, we're going to be monitoring Twitter for questions and comments. To be able to get on Twitter, you're going to have to, we need you to use hashtag Shy, WAD11, and our Twitter handle is @ShyPublicHealth. And I'm going to take off for a few minutes, and I'm going to let you guys have a hangout while I check out what's going on Twitter.
All right. Thank you so much, Jose. It's great to see you all, guys. Thank you so much for joining us. And you know, it's interesting. 30 years ago, when this epidemic started, it was definitely we never have thought that we'll be at a day where we're having a conversation right on Google Plus and hanging out live on live stream as well. You know, as I reflect on our own department, we're thinking now about creating apps, or we're creating apps to let people know where they can find free condoms. We're using the internet for partner notifications. We are really rethinking a lot of the way that we do HIV services. So maybe, Ray, you can start by just sharing with us how you use Twitter and Facebook to help spread the message about the importance of HIV prevention and HIV work.
Well, because AIDS is not the most popular topic anymore, and the economy, it basically affected me speaking, which is what I do. I travel the country at colleges and speak to young people about HIV. But I still saw a need for a message, and so I started on Facebook, and from Facebook I've gone to Twitter. And, you know, young people are there, and they are dying for the information, and so I spend my entire day on Twitter. So it's a day in the life of a diva living with AIDS. So they get me from early in the morning to late at night. They get the good, the bad, the ugly. When an IV is going in my arm, they see the IV going in my arm. When I'm glamorous, they see me glamorous. And what they're seeing is that, yes, one, you can live with AIDS, but that AIDS is a hard disease to live with, and so that you want to prevent yourself from becoming HIV infected. And so I use it to educate from A to Z, and it has really been effective for me. In a year and a half, I have about 5,200 followers on Twitter. I blog, and so Mondays are reflections. They're spiritual, to give people hope, people living with AIDS hope. And then through the rest of the week, I basically do HIV/AIDS education and give them some sense of what my life is like living with HIV. In a year and a half, I've had about 25,000 visits a month. And what we know is that people are reading the content because they're staying on my blog 6 minutes. And so what I've done is, the people weren't bringing me, so I went to the people. And it's been a very effective tool for me.
Yeah, and you know, Ray, I'm actually one of your 5,200 followers, and then as I reflect on and read your tweets, I'm always compelled to kind of have a follow-up question. Are you getting that type of engagement and interactions with your followers?
Oh, absolutely. I talk back to absolutely every one of my followers. They ask me questions. They make comments. They encourage me. So remember, over the summer, I was going through IV medication. They encouraged me the entire 5 hours I was on IV meds. They, you know, kept me going. They, you know, prayed for me. They asked me questions. About a couple of times a week, what I do is I just have open mic, where no question is too personal, too stupid, or silly. And so not only are they asking me questions and I'm giving them the answers, but then they're retweeting it to their followers. So for example, if Cinnamon, who's one of my followers, asks me a question and I answer it, my 5,200 followers have seen it. But then if she retweets it, her 31,000 followers have seen it. And so in 60 seconds, well, 30 seconds, we've had, 3,600 people exposed to information about HIV. And what I do is I'm consistent in my dialogue with them, and I make them feel that I'm just not here to preach to them, but that I'm here for them.
Right. And I think, we've seen over the last few years that this trend is also moving towards, advocacy with government agencies, with the Congress and with others, and organizations like the AIDS Foundation of Chicago that do great work on advocacy. I think, Keith, maybe can you let me know what your thoughts are on the use of technology in advocacy right now?
Sure. I think, and we've seen technology really as a very strong mobilizing force, particularly with young people. I think, the last presidential election really showed us the power of Facebook and of Twitter to spark interest and then keep momentum going for a candidate. Young people are thirsty for knowledge, thirsty for information, and want to be involved. They want to be connected to something that speaks to them, that they feel they have a part or say in, and that will move them forward as human beings. So I think we don't give our young people enough credit, and Facebook and Twitter are really avenues and areas where we can engage them in a place where they already are, and that they will actively participate and become involved.
Yeah, and I get so many tweets where I'm tagged about some type of advocacy piece almost every day. So it's always interesting for also me to be able to communicate with folks right away with that instant response. But I still do, every Wednesday I pick up my Windy City Times from one of the neighborhood stores, and maybe Tracy could kind of reflect a little bit as being a co-founder of Windy City Times here in Chicago, a great asset to our communities. How have you seen these things have changed?
Well, when I started working in gay journalism in 1984, there were fewer than 100 diagnosed cases of AIDS in the city of Chicago. And immediately I knew that this was kind of like being in the middle of a war zone. Some of the people that were very prominent activists begin to pass away within days or weeks of diagnosis. One of the co-founders of Windy City Times was diagnosed within a month of our founding in 1985, and he was gone within a year. But many of our writers died within weeks. We lost dozens and dozens of people in our ears. One of the things I think that's really important as a journalist is that we continue to cover the cutting edge stuff that's happening on treatment, but that we do not forget the legacy of the 1980s and 1990s of the people that we lost or the people that are surviving through this. We've obviously profiled Ray a lot over the years, and Keith, and so many activists that are survivors. And part of the 9-month series we're doing right now on AIDS at 30 is both kind of balancing that new and current information, but making sure the young generation has role models that are here today and also remembers the tremendous loss, the toll that AIDS took in Chicago, especially during the 1980s and 1990s. So we're kind of doing both. We're doing this history project, and on ChicagoGayHistory.org we have a lot of old information. And then on Windy City Times we're doing all sorts of ways to keep AIDS in the news every single day. We tweet, we Facebook, we do all sorts of things through all social media, but also through our traditional Windy City Times print paper.
Yeah, so today we actually just issued our HIV report that we issue, the HIV Surveillance Report that we issue every year. And, we have 20,391 people living with HIV here in Chicago. We estimate there's a 5,000 more who have HIV who are not aware of their status. And we also are seeing a shift in the age distribution with more and more younger people being diagnosed. Is this a surprise to any of you here? Tracy, if you want to start, and then we'll also hear back from Ray and Keith.
It certainly is not a surprise, and I don't necessarily, I always saw that even in the 80s and 90s, a lot of what was happening was the lack of education, so it didn't really depend on your age or your social status or anything like that if you were not being reached and targeted. And I think there was a lag that happened a few years ago that now we're seeing, unfortunately, the repercussions from. So if the education's not happening across the city, it makes sense that there are going to be pockets of the city that are going to see larger increases. Young people with self-esteem issues, whether that's gay or straight. If they don't have self-esteem issues, that's going to be a contributing factor. So, you know, it makes certainly sense to me, covering it as a journalist, that these trends are happening, and I'm hoping that there's lots of different solutions, and one of those is media. We're trying to give voice to some of the young people through the pages, through their own columns and their own photos, and writing about their lives to maybe help build some self-esteem as well.
Yeah, Keith, do you think we're doing enough, or we're doing the right things to reach out to this special group that we're having difficulty reaching out to?
I think we're doing a lot of the right things, and I think that there's a lot more that we could be doing and that we need to be doing. Most importantly, as we were chatting earlier, we have to create communities of care where people feel valued in the places where they would go to receive HIV testing, treatment, you know, conversations about lifestyle. People have to feel valued in those places, and if we don't, then we're less likely to go. We're less likely to be tested. We're less likely to, you know, take antiretrovirals the way that we should. And those are the things, the concrete things that will end the epidemic. So we need to do more of that, I think.
Ray, do you want to reflect on this World AIDS Day for us in 2011?
You know, we were talking earlier, and for me, World AIDS Day is bittersweet. 17 years ago today, I was the first black woman to tell my story on the cover of a major magazine, and by doing that, me and Essence, we changed the face of AIDS for black women, but we also changed the story for women, black women with AIDS, and women, heterosexual women for AIDS. And I would think that we would be a lot further along than we are, when in fact 72% of the cases of women infected with HIV are African Americans. So, you know, as we reflect and we, you know, we have a party of a sorts, and we rejuvenate, you know, as Keith said, around World AIDS Day, it's really bittersweet for me that, yes, we're here. Yes, I'm still here, because think about it. The cover of Essence said, "Facing AIDS, young, educated, drug-free, dying of AIDS." But I'm still here 17 years later, and so that says technology, it says medical advancements have, you know, kept me here. But the fact of the matter is that the number of cases are still rising among black women, and so for me, it's a bittersweet day.
What about for you, Tracy? Reflections on World AIDS Day 2011.
It is quite depressing to me that we are still talking about so many of the same things, as Ray said, from 17 years ago. I believe that we're not getting the youth young enough, for example, in the high school level, with adequate sexual education. There's still too much fear, even in the city of Chicago. I talk to high school students all the time, and they say they don't find out about STDs in school. Very few. I mean, it's almost like they're finding out less than I found out in the 1970s at Lane Tech High School. So we need bold people that are willing to even risk their jobs to give this information to them when they're at their most pivotal point in their young teens, to make these choices. My other thing is that I do believe that LGBT youth in particular, and trans probably mostly, really need more role models, and they need more of their history so they understand they're part of this decades-long tradition. So that, again, it's about, to me, building self-esteem, and part of that is that you're not alone. If you're the only openly trans kid in your school, you're not alone. You need to be far more connected to your legacy and to current people in Chicago. Unfortunately, this week we lost Lois Bates, one of the most important transgender leaders in our community, and she was really terrific in talking with youth. I hope someone can fill her shoes.
Yeah, and I mean, to me, you know, as Mayor Emanuel and I stood together on August 16 and we released Healthy Chicago with all of our priorities, and you know, we made sure that HIV prevention is one of those priorities. This is something that we have to be working on. It is a public health issue. We have to be addressing very aggressively. A day like the World AIDS Day, it kind of confirms that this was the right decision, and most importantly, hearing from folks like you really kind of reinforces that message about the great work that's happening in the community, and you guys are my heroes. So I want to thank you for joining us today, and I'm going to go back to Jose to see if we've got any questions from Twitter. Jose?
Hi, Dr. Bashara. So there is one question that just popped in. Folks want to know what can we expect from for AIDS in the next 30 years as we reflect on these 30 years. And just as a reminder, if someone wants to join the conversation on Twitter, the hashtag is hashtag shy WAD11.
All right, Keith, do you wanna take the first shot at answering the question, AIDS in the next 30 years?
Sure. So my hope is that we're not talking about AIDS in the next 30 years. My hope is that we are beyond this epidemic. We have the tools to end this epidemic with things such as pre-exposure prophylaxis, treatment as prevention, behavioral interventions, all of this stuff that we know works. We've got to scale it up and get the right messages and the right interventions to the right people. And we can end this epidemic tomorrow if we chose to. So 30 years ago, I won't be talking about AIDS. I'll tell you about me. But I would hope that our community is not going to be talking about AIDS. We will be talking about how we can, build better community.
Yeah, I think from my perspective, it's interesting that I think our language is changing right now. Instead of talking how we're dealing with AIDS, we need to talk how we're ending AIDS. And this is really the conversation that needs to start today so that 30 years from now, this is no longer an issue that we need to have. Any reflections from you, Ray?
I agree with Keith wholeheartedly. While we do have to get more people in treatment and care, people can live a long time with this disease. We have to deal with that. But I've said it, I continue to say it, prevention is key. We have got to reach people at their core. We have to reach people who don't see themselves at risk. I think risk is a dangerous word because no one really sees themselves at risk for HIV. And so the question really is, how do we as a community together end the AIDS epidemic? And something that we really don't talk a lot about, which has, Tracy, I believe has something to do with education in high schools, is personal responsibility. We have to begin to talk to young people, not down to young people, but really let them begin to see what the consequences and choices are of some of the decisions that they make in life, because these are lifelong decisions that you can't get around.
Ray, I actually want to ask you a question. So this morning we kicked off our condom distribution campaign as a department. We're making a commitment to distribute 10 million free condoms this year in Chicago. And this morning we were at different CTA stops handing out condoms to kick off this campaign. And everybody was very receptive. But there was a young lady who came in with her 9-year-old child, and she said, is it appropriate for you guys to be out here in public, talking about HIV while I'm walking to the train with my 9-year-old son? How would you respond to this lady?
I would say to her that if she don't talk about it now, she may have to really talk about it when her child turns 13, 14, 15, and 16. I think that we have to, one, make people compassionate about HIV, and so that the conversation early with young people becomes a compassionate discussion, an education discussion. HIV is a health issue. These are family members, people. But then as they move to adolescence, we really have to have that serious conversation about AIDS. So the fact that she doesn't want to talk about AIDS at all around her children, I think it's very naive on her part. And I would challenge that.
Mm-hmm. Jose, do we have...
Yeah, actually, I just wanted to break in right now. Since we're talking about condoms, I think it was appropriate now to be able to tell you guys that it's time to wrap it up. Commissioner, I want to give you one last shot at saying something else right before we close out.
No, I want to thank everyone for joining us today. This was the city's first Google Plus Hangout, and we are streaming live on the mayor's live stream page. So I want to thank you, Tracy. Thank you, Ray. Thanks, Keith. We're going to continue the conversation. I'm sure, Ray will continue the conversation on Twitter. We are going to be answering questions as well on Twitter. Thank you so much for joining us, and we'll talk soon.
Thanks for having us.
Thanks. Bye. Good night. Thanks.
Good night.
Good night.
Bye-bye.